Welcome back to our channel. Today we're diving into a hot topic, the rise of AI in mental health care. From chatbots to mental health apps, AI is making waves. But is it all good news? Well, that's what we're here to explore. We're talking about algorithms and empathy, folks, and it's going to be fascinating. So buckle up, hit that subscribe button if you haven't already, and let's get into it. One of the most prevalent ways AI is entering the mental health space is through chatbots. We're talking about apps like Woebot and Replika, designed to provide on-demand support for things like anxiety and depression.
Now, I know what you might be thinking. Talking to a bot? Really? But hear me out. These AI-powered chatbots use natural language processing, which essentially means they're designed to understand and respond to human language in a much more nuanced and helpful way. They can learn your patterns, remember your experiences, and even offer personalized coping mechanisms.
Imagine having a little AI friend in your pocket who's always there to listen, offer words of encouragement, or help you reframe negative thoughts. Of course, it's not a replacement for human interaction or professional therapy, but it can be a very valuable tool, especially for those who might not have access to traditional mental health care or who just need a little extra support between therapy sessions.
But, like with anything else, there are limitations. Chatbots can't fully understand the complexities of human emotion, and there's always the risk of misinterpretation or providing inaccurate information. That's why it's crucial to use these tools responsibly and in conjunction with professional guidance. Still, the potential here is huge.
In the next chapter, we'll move beyond chatbots and explore the wider world of AI-powered mental health apps. Get ready to have your mind blown because these apps are doing some seriously cool stuff. So, we've talked about chatbots, but they're really just the tip of the iceberg. There are apps designed to help you track your moods and identify triggers, apps that use biofeedback to teach you stress reduction techniques, and even apps that analyze your voice patterns to detect signs of depression or anxiety.
One of the most exciting aspects of these apps is their potential for personalization. They can learn your individual needs and preferences and tailor their support accordingly.
But, as with any new technology, it's important to approach these apps with a healthy dose of skepticism. Not all apps are created equal, and it's crucial to do your research before entrusting your mental well-being to any app. Look for apps that are backed by scientific evidence, developed by reputable organizations, and prioritize data privacy and security.
That being said, the potential for these apps to revolutionize mental health care is undeniable. They offer a level of accessibility, affordability, and convenience that traditional therapy simply can't match.
But what about the bigger picture? How is AI changing the way we access mental health resources in general? Well, that's a question we're going to tackle head-on in the next chapter, so grab a metaphorical shovel and let's dig deeper. One of the most significant ways AI is impacting mental health care is by breaking down barriers to access. For many people, traditional therapy can be expensive, time-consuming, and geographically inaccessible.
AI has the potential to change all of that. With AI-powered apps and chatbots, you can access mental health support anytime, anywhere, right from your smartphone. No more scheduling conflicts, no more long commutes, and no more awkward waiting room encounters. This is particularly important for people in underserved communities, rural areas, or those who face stigma surrounding mental health. AI can provide a discreet and convenient way to access support without fear of judgment or discrimination.
Furthermore, AI can help address the shortage of mental health professionals by automating certain tasks, such as scheduling appointments or providing basic information. AI can free up therapists to focus on what they do best, providing personalized care and support. Imagine a world where everyone who needs mental health support can get it, regardless of their location, income, or social background.
But of course, it's not all sunshine and roses. As with any new technology, there are ethical concerns that need to be carefully considered. And that, my friends, is precisely what we'll be exploring in the next chapter.
We've talked about the potential benefits of AI in mental health, and they're impressive, right?
But, like a compelling novel, there's another side to this story.
We need to talk about the ethical tightrope walk with AI in mental health care.
One of the biggest concerns is data privacy.
Where is this data stored? Who has access to it?
Then there's the issue of algorithmic bias.
And of course, there's the question of human connection. Okay, let's address the elephant in the room, or rather, the chatbot in the smartphone. Is AI here to replace therapists and revolutionize mental health care completely?
Well, that's a bit like asking if a calculator will replace mathematicians. Sure, it can help with calculations, but it can't replicate the creativity, intuition, and problem-solving skills of a human mind.
The same goes for AI in mental health. While AI can be an incredible tool for increasing access, providing support, and even assisting therapists with certain tasks, it's not about replacing human interaction and expertise.
Instead, it's about creating a collaborative approach where AI and human therapists work together to provide the best possible care for patients. Think of it like this. AI can be the Robin to the therapist Batman, the Watson to their Sherlock, the Chewbacca to their Han Solo.
It's about leveraging the strengths of both AI and human therapists to create a more comprehensive and effective approach to mental health care.
Imagine a world where therapists can use AI to analyze patient data, identify patterns, and develop more personalized treatment plans. Imagine AI assisting with administrative tasks, freeing up therapists to spend more time with their patients.
Imagine AI-powered tools that help patients track their progress, stay motivated, and access support between sessions. That's the power of AI working in tandem with human expertise. Okay, we've talked theory, we've explored possibilities, but what about the reality? What do people who actually use AI mental health tools have to say about their experiences?
Well, it's a bit like asking a room full of people about their favorite ice cream flavor. You're going to get a variety of opinions. Some people find AI chatbots and apps to be incredibly helpful, providing a sense of support and companionship they might not otherwise have.
They appreciate the anonymity, the 24/7 availability, and the non-judgmental space to express their thoughts and feelings.
Others might find the experience a bit impersonal or even frustrating. They might miss the human connection, the empathy and understanding that can be so crucial in mental health care.
And then there are those who find AI tools to be a valuable supplement to traditional therapy, a way to bridge the gap between sessions, track their progress, or access support when needed.
It's important to remember that everyone's experience with AI mental health tools is going to be unique. It depends on individual needs, preferences, and expectations.
The key takeaway here is that AI mental health tools are not a one-size-fits-all solution. They can be incredibly helpful for some people, but they might not be right for everyone. So, we've journeyed through the present landscape of AI in mental health, explored the benefits, the challenges, and heard from the people actually using these tools. Now, let's put on our speculative hats and gaze into the crystal ball of technological advancement. What does the future hold for AI and mental health?
Well, for starters, we can expect to see AI becoming even more sophisticated and personalized. Imagine AI algorithms that can analyze your voice patterns, facial expressions, and even your writing style to detect subtle signs of mental health conditions.
Imagine AI-powered virtual reality experiences that provide immersive and engaging therapy sessions.
We might even see AI being used to develop new medications and treatments for mental health conditions, personalized to your unique genetic makeup and medical history.
But as AI becomes more integrated into our lives, it's crucial that we proceed with caution and thoughtfulness. We need to ensure that these advancements are driven by ethical considerations, prioritize patient privacy and autonomy, and address existing biases in healthcare.
We also need to remember that technology is just a tool. It's how we choose to use that tool that ultimately determines its impact on our lives.
The future of AI in mental health is full of possibilities, both exciting and daunting. So what do you think? Could AI be a game changer in mental health care, or do you think it lacks the human touch? Let us know in the comments below. Have you tried any AI tools for mental health support? Do you prefer human therapy? Or could AI be a good supplementary tool? This is a conversation that's just beginning, and your voice matters. Share your thoughts, experiences and concerns in the comments. Let's keep the conversation going and work towards a future where mental health care is accessible and effective for everyone. Don't forget to like, share and subscribe for more insightful content.